the disease prevention. This is the community health nursing. There are 3 levels of prevention: primary prevention, secondary, and tertiary. We're going to talk about the primary prevention. So always remember, prevention is better than cure. The primary prevention, basically the client or population or community, no disease at all, right? And no impairment. So when, as an example, mother, when pregnant, they has to go for the prenatal care. Why they has to go to the prenatal care? Because they want to prevent any kind of complication during the pregnancy. Like when mother is pregnant, if they took the folic acid, they can prevent the neural tube defect. So this is the primary prevention, right? Like the baby when born, we give them immunization. So the immunization is a primary prevention, right? So here also, like environmental cleanliness or sanitation. The sanitation is a primary prevention. You can stop the communicable disease or infection. You can stop with a good, healthy drinking water or improve the sanitation facilities. So this is the example of the primary prevention. So this, when you when the children drive the bicycle or if you drive the motorcycle, we wear the helmet. So helmet protect me to get injury in the brain, right? So this helmet wear primary prevention. So go and see what are the example of primary prevention. As I told you, any kind of scanning or immunization, clean environment, sanitation, drinking water, example of primary prevention. So, you know, the deficiency of protein develop kwashiorkor or marasmus. But if you give a quality and quantity enough protein, baby do not develop kwashiorkor or marasmus. So the primary prevention. Family planning, or when adolescents or active sexual life use the barrier or safe sex education, you have to prevent some STD, sexual transmitted disease. This is the primary prevention. You know, the smoking causes cancer, lung cancer. Stop the smoking, or smoking education is a primary prevention. So also the education related to the hygiene, like as I told you, sanitation, clean environment, drinking water can prevent the disease. Safety education like seat belt wear, helmet wear, this is the primary prevention. Immunization, primary. Also advocating for any kind of access to the health care or healthy environment are the example of primary prevention. The secondary prevention, always keep in mind, early recognize the disease. When you recognize the disease, then we will try to prevent the progress of the disease, right? So early detection or testing or scanning is the secondary prevention. So I said imagine your patient chance of the diabetic. So diabetic scanning is the secondary prevention. So if the patient has a diabetic, then they has to take the insulin, right? And this diabetic or medication of the diabetic to control the disease, secondary prevention. Like same as the hypertension scanning or testing for the hypertension, medication taking for the hypertension, the secondary prevention. HIV scanning, the secondary preventive method. Benign enlargement of prostate, right? So this is the scanning for secondary prevention. So here we say, what are the example of secondary prevention? Any kind of community assessment, any communicable or non-communicable disease, scanning is the secondary prevention. So early detection and treatment of the disease, right? With the goal of limited the severity. So if you do not control the diabetic, so blood sugar increase, uncontrolled diabetes mellitus kill your kidney, bite your heart, leak your brain, right? And diabetes is important cause of the um, um, peripheral neuropathy or eye problem, right? So if you tell your patient to take the insulin and stop that progress of the disease, limited the severity of the disease, this is secondary prevention. So any kind of testing, any kind of scanning is a secondary prevention, like breast examination, cervical examination or lab test, testicular examination, prostate examination, colorectal scanning, everything is a secondary prevention because you want to find out the chance of cancer develop or not. Hypercholesterol management, lifestyle change, exercise, anti-lipid medication like statin to prevent atherosclerosis. If you do not prevent atherosclerosis, they lead to MI and heart failure. So control or scanning the hypercholesterolemia is secondary prevention. TB scanning, lead exposure, secondary prevention. Any kind of scanning for genetic disorder or metabolic deficiency in the newborn, scanning is the secondary prevention. Control of outbreaks of the communicable disease is the secondary prevention, right? And the last one is the tertiary prevention. Tertiary prevention, basically, example, the dietary measurement or nutritional and prevent the disease. So tertiary prevention containing the disease, already patient have the disease, right? Already patient have the disease, patient diagnosed the disease, they have an impairment of their body function, but still they try to adapt, they try to stop the disease process, already diagnosed, right? The tertiary. So tertiary prevention already containing the disease, physical, like disease is diagnosed, then going to give the physical therapy. So physical therapy like after the brain stroke or physical therapy after heart attack. This is the tertiary prevention. Or dietary measurement for HIV/AIDS patient. So you know the HIV/AIDS patient is the immunocompromised. So because of immunocompromise, they easily attacked by the infection. So nutritional support help to boost up their immune system. So this is tertiary prevention. What are the example of tertiary prevention? They said nutritional counseling for management of the Crohn's disease, exercise, rehabilitation, case management, any kind of chronic disease, mental illness, or physical therapy or occupational therapy, supportive group therapy, all are the example of tertiary prevention. Like patient is diagnosed by a bipolar disorder, then you are giving or united them in a group therapy. So in the group therapy, you are trying to improve their health. You are trying to not to go more worse, right? This is the supportive group is the example of the tertiary prevention. So primary prevention, secondary prevention, tertiary prevention, there are three levels of prevention of the community health nursing. So